From the studios of NBC 12 and ABC 25, this is First Coast News at 6.
Good evening. A Jacksonville patient is no longer in isolation for Ebola. A spokesperson with Memorial Hospital says the patient came in overnight Wednesday saying he or she had Ebola symptoms and had contact with someone living outside the U.S. The unidentified patient was screened, tested negative, and was removed from isolation. And First Coast News is committed to bringing you facts, not fear, about Ebola.
We have team coverage on how the virus could affect you, your family, or even your pet. First Coast News' Andrew Capasso is live at Memorial Hospital with more on what you should do if you think by some chance you've contracted Ebola.
Well, good evening to you. In the last week, 2 hospitals here on the First Coast have put patients in isolation because of Ebola concerns. As Shannon was saying, in this case this morning and at Baptist on Monday, Ebola was quickly ruled out. Now, a local doctor says in part because Ebola is so hard to transmit, the emergency room may not necessarily be the first place you need to go if you're feeling sick.
They're going to be concerned about it. I think my advice would be you first call your doctor.
Dr. Mobeen Rathor, president of the Duval County Medical Society, says emergency rooms across the country have been swamped with people thinking they might have Ebola.
A lot of people are going to have those symptoms these days because it's starting the flu season now, and so they're going to have fever, runny nose, cold, cough, maybe have diarrhea. But I think most of them are not going to have Ebola.
That's one reason. He says picking up the phone and calling your doctor is the better first step to take.
Explain it to them and tell them what are the signs and symptoms you have, and the doctor should be able to screen that on the phone and be able to say whether you are at risk or not.
Memorial Hospital wasn't the only hospital to put someone in isolation Thursday over Ebola concerns. Hospitals in Texas and Connecticut also had scares.
If going to the emergency department is necessary in some situations, and your physician will be in the best position to advise you on that.
He says, though, the deadliness of the disease combined with lots of questions about it spark a lot of concern.
Of course, Ebola is scary, so I don't want to minimize that. People are scared about it. So, I'll say the same thing I've said before. You have to be aware, not beware of this disease.
He says a call to your doctor could save both time and money. And of course, if you're in a life or death situation, of course, the emergency room is the place you need to go. But as for Ebola, Dr. Rathor says the best thing you can do right now to protect yourself is just get a flu shot. He says we're starting up flu season. It's much more contagious than Ebola, and it is also fatal. As a matter of fact, he says tens of thousands of Americans die each year from the flu. And so far this year from Ebola, only 1 person has died. Reporting live on the south side, I'm Andrew Capasso, First Coast News, NBC 12, ABC 25.
That puts it into perspective as of right now. Thank you so much, Andrew. The first Texas nurse to test positive for Ebola is being moved out of Dallas to continue treatment. Nina Pham will be transferred to a National Institutes of Health facility in Maryland. Pham contracted the virus treating Ebola patient Thomas Eric Duncan, who died last week at Texas Health Presbyterian Hospital. Meantime, hazmat crews were back at Amber Vincent's apartment in Dallas today. She's the second nurse diagnosed with Ebola in Texas. Crews have been decontaminating the facility for the past few days. She contracted the virus also after caring for Duncan. She is currently being treated at Emory University Hospital in Atlanta.
And the plane that carried Amber Vincent later flew to South Florida to an airport there before it was taken out of service. The plane was used on Flight 1143. It was used again on a flight from Cleveland to Fort Lauderdale Hollywood International. That flight also made a stop in Atlanta. Frontier Airlines removed the plane from service following the CDC warning. The airline said the aircraft was immediately decontaminated. And dogs and cats, if you were wondering, cannot transmit Ebola.
But our Laura Casa found out there are animals which do carry and transmit Ebola. She's live in Springfield. Continue our team coverage tonight.
That's right. Pet owners, your cats, your dogs, they cannot transmit Ebola. We're here at the Confederate Park right now. You see dogs running around. This is according to the CDC, who's saying that your pets cannot transmit the disease. But there are mammals that can. They can get sick from it. Worse, they can spread it. Ebola. No, it's not spread through the air or by water or in general food. Humans, we can spread it. And studies show other mammals can too.
Apes, primates, things along those lines have been known to carry Ebola in Western Africa.
Local vets Dr. Tim Holloway and Craig Sandler say bats, fruit bats, can also carry and spread the virus.
Fruit bats, which we believe, or the CDC believes, that's a natural reservoir for Ebola.
Should we be concerned here on American soil?
At this point, there's really not that much concern. The bats here in the United States, they do carry other diseases, so we should exercise caution. One of the major diseases that they carry and transmit would be rabies.
And what about mosquitoes? Well, according to the Florida Veterinary Medical Association, there is no evidence that mosquitoes and other insects can transmit the Ebola virus.
Here in the United States, it's not really of huge concern. Of course, there is always concern, but the chances are very, very slim that you or your pet here in Jacksonville, Florida, are going to be affected by Ebola.
And now there are also studies that show that wild animals like antelope can also carry and transmit the disease. But I want to stress this is not something to worry about as far as animals in the U.S. This is only in Africa, in those parts that are most infected with this virus. We are live in Jacksonville. Laura Queso, First Coast News, NBC 12, ABC 25.
Laura, thanks so much. Florida wants to spend more than $7 million to help the state prepare for any potential Ebola outbreak. State officials say they want to use federal grants to buy full-body suits for healthcare workers who may have contact with any potential victims. Governor Rick Scott previously asked for 100 suits from the federal government, but that request has not been granted as of yet. The state of Florida also asked for 30 additional Ebola testing kits from the CDC. So how prepared is our healthcare system for an Ebola virus outbreak should it happen?
Well, hospitals from the largest metro areas to rural Baker County are all preparing for any possible case. On your sides, Ken Amaro continues our team coverage. Ken?
Shannon, I think this speaks to the seriousness or the concerns of this disease. Every healthcare provider wants to be as prepared as possible, whether it's a large facility like the hospitals here in Jacksonville or a facility that serves a community of 27,000 people. At Ed Frazier Memorial, a small hospital in rural Baker County, they're preparing for Ebola just in case.
We have identified a room that we have designated an Ebola room.
Room 7 in the emergency department will be used to isolate a patient that may have the Ebola virus. It meets CDC criteria. Dr. Patricia White is medical director of the ER.
The probability is not zero, therefore we're just preparing.
Frazier Memorial is a 25-bed facility. There are no infectious disease doctors on staff, and even though it is unlikely, they know it can happen. Linda Farley is director of nursing.
We've been doing daily drills.
The staff has been trained to ask certain questions during admitting. If the patient meets the criteria, the person is isolated and the staff puts on protective gear. Do you have enough of those here at the hospital?
Yes, we do.
Farley says the response to patients with even flu-like symptoms is quick.
We wear masks and gloves with all patients that present with flu-like symptoms, and we mask the patient.
The drills are repetitive. The goal is to isolate a potential case and transfer the patient to a nearby facility with an infectious disease staff. But for now, Frazier Memorial feels prepared.
It's hard to say I feel, adequately prepared when I feel like I need to do more. So I think that in the fact that we're still striving to make sure everybody's safe and protect the patients as well as our staff, that is adequate, yes.
The hospital staff will remain at prepared status until told to do otherwise. But what I keep hearing from healthcare professionals is that they are more concerned about problems like the flu as we head into the flu season, and also the entire virus, which is an airborne disease. So there are greater concerns than Ebola right now for the healthcare community. Back to you.
All right, thanks so much. Our whole theme tonight is facts, not fear. And right now we have two experts from Orange Park Medical Center. Dr. Lawrence Coots is an internist, and he's medical director of Orange Park Medical Center. And Connie Wolf knows all about preventing infections from spreading. So, Dr. Coots, people are still calling us just minutes ago and saying, is Ebola here? So let's just knock out that myth right now.
To date, there's been no diagnosis or finding of Ebola in the state of Florida.
Okay, that's important to know. And Connie, let me ask you, people are saying, oh no, what about flu season? What if I get a fever? How do I know if it's Ebola or if it's flu?
Ebola, you have to have direct contact with a person who's ill with the symptoms of Ebola.
And so what about people who say, oh no, I've been in Dallas. You've been getting calls like that. I'm worried I might have caught it.
Right. There's no spread of the disease at this time, and I recommend that they follow up with their healthcare professionals if they have questions, and follow with the CDC and the Department of Health in Texas.
Let's just say there's some slim chance that you ended up on an airplane, Dr. Coots, next to somebody who had Ebola and they sneezed on your tray table. What can kill Ebola off a hard surface?
Well, first off, Ebola does not survive very well on hard, dry surfaces in the first place. And secondly, if you carry some bleach towelettes or something like that, you can take the surface that you're sitting in front of and clean that, and the Ebola is almost essentially wiped out instantaneously.
And for people who are calling and wondering, can it be spread and put in our water system, the answer is no, it does not spread through the water, correct? All right, very good. So again, they are here to answer your worries, your concerns. Let's just knock out all the myths and make sure that we know the facts about Ebola. 632-1200. Shannon?
Helping the most vulnerable among us, that is what's being done to make sure more infants survive on the First Coast. Also feeding those who can't feed themselves. Teenagers come together to lead the way to the future.
Beautiful weather out there today. Anthony sends this in from Fernandina. Today's high 78, but tonight, as that sun goes down, who could see their coolest readings since last April.